What is going on, everybody? Happy Tuesday. I hope everybody's doing well. I just wanted to hop on here and give everybody an update on the injury I talked about a month ago, and let everybody know what's going on, bring them up to speed, and kind of what the plan is and next steps. So for those of you that care and been following along, some of you already know I've been talking to my clients about this for a while, but I thought it'd be good just to throw it out there so I can let everybody know. So first thing, to give a little bit of history, about a month ago, I had an appointment, went into Iowa Ortho, and they examined my shoulder. And so to back up, what happened was I had an injury about 5 years ago initially, and at that time I didn't get it really looked at. I didn't go in and get surgery or anything like that. I went to PT instead and got that up to semi-full functioning enough. So what's up, Shalene? And it worked fine. So for 5 years, and then back in November, what's up, Brad? Back in November, I actually went to a powerlifting meet. I did the meet, and on my last bench press attempt, felt a pop in my right shoulder, felt something going on there, and since then it's been painful, it's been weak, and obviously it's time to get something done. So fast forward, I went in and I got an MRI, first I got an x-ray, and they said, "You've got a big old bone spur in there." And I'm not surprised, because I had one in this shoulder that I got fixed about 15 years ago, and they said that I probably would have one in this one as well. Sure enough, I do. And so the x-ray confirmed that. And then I went in and got an MRI about a month ago or so, and confirmed what had expected. So I do have some muscles torn in my shoulder. I have got a supraspinatus that is torn. That's a full tear. And then a subscap right here, that's a partial tear. And they also, again, confirmed that big old bone spur that's going on in there. And so the plan is I am going to have it repaired. I've got surgery scheduled for next week. But there's a couple challenges with this. So the first challenge is this first exercise, or this first muscle up here that fully tore, actually retracted. So it pulled away by about 3 centimeters. And that's what I felt when I was doing my bench press and I felt something move. That was that muscle letting go and retracting. The challenge with that is they don't know if they're going to be able to get it to reattach it. Okay, so that's the first challenge. The second challenge is the other muscle that's torn, the subscap. Even though it's a partial tear, so there's still some reattached, this is the one that I tore way back in 5 years ago, and they said that there's some scarring there, and they're not sure how well of a connection they're going to be able to make there. So that's the other challenge. And so they have told me that they're going to try and do it orthoscopic and go in there, which when they just use the tools, make some small incisions. However, they said when they initially get in there, they might find that they're going to have to actually cut me open and to be able to get to everything and put everything back together again. And even if that happens, they still can't guarantee that they're going to be able to get it all completely repaired. And so I told them, I said, hey, you know what? I'm like, do what you got to do to get it fixed. That's the main thing. The good news is labrum looks like it's in good shape, and the other rotator muscles as well. So no atrophy of the rotator muscles, and I've been training around it. Some of you have been seeing some of my training videos. I've been modifying a lot of exercises so I can still train those muscles around that. Still, my pec is the thing that is the toughest to train, and obviously I'm very limited on my deltoid as well. And so doing what I can do to still train around that, and then of course train all the other body parts like normal. And so that's the game plan. Now, after I have surgery next week, here's what's coming up. So I'll have that done, and then I'll be in a sling for 4 to 6 weeks, maybe longer, as that initial healing takes place. After that, then I'll start doing rehab, and that rehab process is probably 6 months. of doing PT and things like that to get it up to that first level. And then after that, then it'll probably take another 6 months after that to get it to the point where it's, back to full strength, whatever that is. And I've got some benchmarks and some goals that I'm hoping to hit to make that happen. So all in all, it's going to be probably about a year process before it's back to normal or whatever that new normal is. And so that's the process. And again, we don't know for sure as far as, if it's going to be able to get fully repaired. But, right now I'm struggling with sleeping. It wakes me up in the middle of the night. Not to, make a sob story out of it, but it definitely needs to be repaired. And obviously, like I said, very, very weak in this area. And so I will keep everybody posted. I'm going to procure an ice machine. If anybody knows anybody that has one of those ice machines that you have post-surgery, I'd love to rent it from them. There's no reason to buy one. I'm only going to use it for this. So if anybody knows of somebody that has one, please let me know. I'm going to be putting out a post to see if I know anybody. And then obviously, I'm going to be sleeping in a recliner because if anybody's had a shoulder surgery, sleeping is the worst. And so sleeping upright helps with that healing process and comfort. So that is the game plan. And I will be putting out videos of how this process goes. Again, next Thursday is the surgery. I won't be online probably until after I can, get back to normal as far as after the surgery. But I will keep everybody posted. And then also with training, I'm planning on getting right back into the gym as soon as I can, training around this injury, figuring out what exercises can I do and be able to train around and still make progress on the other body parts. Obviously, I'm going to leave this alone, but I am going to continue to focus on my left side and all those other body parts that aren't affected by the surgery or by the exercises that I do. So anyway, I just wanted to give everybody an update here, and if you cared, appreciate it. If you don't worry about it. But next week is the day. So I hope everybody's doing well. Stay warm, and thanks for tuning in. I will keep everybody updated with this process. Appreciate the support, and have a great rest of the day. Talk to you guys soon. Thanks.